Thank you. Thank you, everyone. Welcome to southern sunny California. It is too bad the taxes are too high in California. But it's so pretty. I just came in from Australia, where I had the pleasure of speaking there for 4 days. And it's amazing the interest that has grown in the world around distal needling and pulse diagnosis. And at the beginning of all these seminars that I give, I always like to thank those who came before me and who made it possible for me to be successful in this business. And that's Dr. Richard Tan, of course, with his balance method, and Dr. Jimmy Chang, whose real name is Zhang Wei-yin. And it's more beautiful to say Zhang Wei-yin than Jimmy Chang, but he just chose the name Jimmy. I guess he liked Jimmy Stewart. So I'd like to thank them. It's the genius of these two gentlemen who were willing to teach, mainly because neither one of them came from a family tradition. Generally, when a Chinese doctor acquires a certain amount of knowledge and it comes up through a family tradition, they're really unwilling to train. Because in China, they've gone through so many political upheavals over so many thousands of years that the number one mantra in the mind of a Chinese mama is survival. The survival of family. And the way the family can survive, if that family knows a profession, if they're an expert at a particular profession, they will pass that profession on through the bloodline. But they feel vulnerable, it's kind of enculturated, it's in their DNA. They feel vulnerable to, sort of come out and give their secrets away. So generally the number one son or the grandson receives the teaching, and then that son becomes a doctor, and so on and so on. So all these brilliant men and women who've come before us, many of them didn't teach to honor that family tradition. And the uniqueness of Dr. Tan and Dr. Cheng is that neither one came from a family tradition. And so they don't feel this pressure to keep the secret. And so they came out and are willing to teach. And I have been exposed on pretty much everything in the business over the last 20 years, 25 years. And unequivocally, a distal method of acupuncture is by far superior to the local method, which I call poke and pray. Sort of put the needles in and pray that the person gets better. The distal method, done properly, you'll run a 90% plus success rate. And then post-diagnosis, there are different methods available that people are willing to teach. The first, I think, foremost in the United States was Dr. John Shen from Shanghai, who's gone now. He was a very, very impressive man, treated millions of people, and became famous in the United States as sort of the Chinese doctor to the movie stars. Dr. Shen, I had the pleasure of studying with for 5 years, and his pulse method has been now, continued on through Dr. Leon Hammer's work. And the only problem with that method of pulse diagnosis is that you're sitting there reading a pulse for 45 minutes, which of course destroys a practice for any Chinese doctor. Dr. Hammer's a psychiatrist, he's a medical doctor, and the medical doctor can reimburse themselves, quite a lot of money to sit there with the patient for an hour, but we can't. So the Shen method, I saw after a while, even though there was a lot of brilliance to it, I realized that, this is not going to work for me. So then I was fortunate enough to meet Zhang Wei-yin, and his method's very, very quick, very fast, and very accurate, and I think superior. Because it recognizes the most important thing in clinic, and that is big things are big. Big things have to be fixed. It's one thing to spend a half hour, 40 minutes with someone and tell them that they were a little nervous and, something bothered their tailbone 20 years ago, and all that's just minutia. If they have a coronary ischemia, it has to be fixed right then and there. You've got to fix it, otherwise the person could die. So we have to be able to zero in on the stuff that's really seriously affecting the health of a patient and fix it. And let the body can usually take care of itself for all these little things. So Jimmy's saying that Jimmy's pulse method is capable of immediately allowing you to immediately see the most important issue. And pulse diagnosis is it's survived the test of time. I mean, it's the 500-pound gorilla in the room when it comes to diagnoses. Not ear diagnosis, not facial diagnosis, not abdominal diagnosis. They're all there and they're all valid. But what's written about from the Wang Di Neijing on is pulse diagnosis. And there's a reason for that. Because the pulse can instantly show you what are the most important things, what's the relationship of the diseases, and what organs are involved in the sort of pathology. So what's involved? Is it just the stomach, or is it the liver, is it the lung, adrenal gland? All that's available from the pulse instantly. That's difficult to get from ear diagnosis. Ear diagnosis can give you a tremendous amount of details, but then where do you start? And to some extent, you have to ask the patient, well, what would you like me to fix? Whereas with pulse diagnosis, you can ask the patient what you want me to fix, but clearly you know what needs to be fixed. So it's a pleasure. I mean, it's not a pleasure. I feel an honor to be a representative of that method. And I've been doing it for many, many years now. And listening to the introduction, I started to feel old. 300,000 patient visits is a lot of visits. And it's true, because we've been seeing over 100 people a day for over 10 years now. And that's 5 days a week. So that's a lot of visits. And so we've learned the hard way. We've learned through clinical experience. So when you're listening to me, you're listening to a pure clinician. I will show you what actually works on the firing line in your clinic. I am not a scholar. I don't profess to be. And I think this profession needs clinicians because it was dominated for years by scholars. And so, a lot of times you listen to nice 8-hour lectures about the Shanghang Lung and all these wonderful formulas, but then when you actually go to practice, you discover, wait a minute, that didn't work that well. Or it works sometimes, but not 90% of the time. So we want to be able to learn, not from a book where, you have all these pat formula, you have these system pat, liver qi deficiency for, emotional upset. And this is your formula. And then you give them that formula and it doesn't work. How many of you experienced this? I can tell you, every book out there, I've done them all. They seriously don't work. Why? Because the pattern discriminations are too simplistic. Pulse diagnosis will help you reveal the exact problem and all the patterns associated, and the most important pattern can be revealed immediately. Otherwise, it will always come down to it's either that or that. It's either wind cold or it's wind damp cold. It's either wind cold or wind heat. It's in internal damp heat or it's excess heat, and you can't quite figure out what it is. Those patients are paying you a lot of money, and you can't afford to be an ideologue. You have to produce a result for the benefit of the patient. So we don't want to promote a method where, you'll feel better. You tell the patient you'll feel better in 6 months. That's not good. You want that patient better in a week, 50% better in 2 weeks, and about 90% better in a month. That's how it's supposed to go. And that's what I'm going to do today. This is the stuff that we use day in and day out. This is not stuff I used 3 years ago. This is what I'm doing right now. Okay? Okay. Having said all that, let's get to work, okay? Because look at this. These are the conditions we're going to talk about today. Weak heart, congestive heart failure. Does that sound like an energetic heart? No, I don't think it really is. How about a mitral valve prolapse? Is that an energetic mitral valve prolapse? I don't think so. How about aortic stenosis and regurgitation, coronary ischemia, sinus congestion, and allergies? Sinus congestion, I guess that's your energetic sinuses are disturbed. Fatty livers, fatigue, anxiety, and depression. These are very real physical problems, folks. And we have a real medicine. We have the best medicine in the world to treat these chronic problems. Western medicine has failed utterly to treat chronic problems very well. Chronic problems in Western medicine are considered not even curable. Did you know that? That's the definition of a chronic disease in Western medicine. They redefined, it's pretty clever actually, they can't fix anything, so they just redefine it and say it's not fixable. Western medicine's brilliance is treating acute problems, and they're the best in the world at it. They will keep you from dying. You won't be healthy, but they'll keep you from dying. Chinese medicine is brilliant at treating chronic problems, and the reason why, this was the medicine that was developed, that was honed, that was polished in the emperor's court for 2,500 years. This was the medicine given to the emperors of China. This was not the barefoot medicine practiced in the villages. That was a more crude medicine. These were bone setters and guys with herbs that could heal wounds. But the sophisticated medicine that we're practicing, once you throw out that energy nonsense, the sophisticated medicine that we're practicing was the medicine that was developed in the emperor's court. How will you know? Pulse diagnosis. And we're going to teach that in this seminar right today. So don't get upset. I am going to show you how to check and make sure from a pulse when the heart's involved in these lung problems. Okay? You get fluid and water retention, dizziness, fatigue and weakness, and rapid or irregular heart beats. These are symptoms of heart failure. This is from a Western medicine point of view.